Hey everyone, Leo Dutil here with L&J Dutil Insurance. I'm an independent broker and I specialize in Medicare products. I know that Medicare can be confusing, and so my goal is to hopefully create some videos to help simplify the process for you and also hopefully answer any questions, or at least some questions, that you may have about Medicare and all of the various letters that come with it. Alright, so in this video we're going to focus on Medicare supplement plans. Okay, so first, what is a Medicare supplement plan? Second, how can we determine which plan will work best for you? How much do Medicare supplement plans cost? Who qualifies for Medicare supplement plans? Is there underwriting or not? And who should or should not get a Medicare supplement plan? In my opinion, I think they work for most people, but there are a few where a Medicare supplement plan may not be the best option for you. Okay, so first, what are Medicare supplement plans? Medicare supplement plans, also known as Medigap plans, are offered by private insurance companies, but they're regulated by Medicare. So as you're probably aware, traditional Medicare does not cover everything 100%. So these plans supplement or fill in the gap where traditional Medicare doesn't cover. Okay, so there's quite a few supplement plans, and each have a designated letter to them, as you can see from this chart, okay, which is directly from Medicare.gov. Okay, now many of these plans may not make sense to get when you look at the cost versus benefit ratio. Some are not even offered by insurance companies, and some are discontinued, okay, unless you're grandfathered into them. Okay, so perhaps one of the most important aspects of Medicare supplement plans, in my opinion, is that there are no networks. Okay, meaning that with a Medicare supplement plan, you can go to any doctor anywhere in the country and they must accept your plan. Okay, as long as they accept Medicare, then they will accept your plan. They cannot turn you away. All right, so I'm not going to talk about every single plan that is on that chart on Medicare.gov, but I am going to highlight a few of the most popular plans and really the plans that make the most sense today. Okay, so Plan G is the most comprehensible plan for most individuals, and I'll explain why I say most individuals in a little bit. But Plan G covers all of the Medicare gaps except for the Part B deductible, okay, which for 2025 is $257, and that is an annual deductible. Okay, so this means that you will pay the first $257 of your medical expenses, but everything else after that, as long as Medicare approves it, is covered 100%. Okay, so you just have to meet that $257 deductible, and then everything else is covered after that. Now that deductible can change year to year, and it usually does. It's usually not by much, but for 2025 it is $257. Okay, so being that it is so comprehensive, this is a very popular plan because even if you do not see the doctor much now, who knows what the next 5, 10, 15, 20 years may hold. Okay, and so having this in place guarantees that you will have great coverage for years to come. Now, in some states, there's also what is called a high deductible Plan G. Now, this still has the same coverage as a Plan G, but you have a much higher deductible to meet. Okay, so instead of just the Part B deductible of $257, in 2025, this annual deductible is $2,870. Okay, so again, that will be the most that you'll pay all year long in medical expenses, $2,870, which is obviously much higher than a typical Plan G, but the monthly premiums for the high deductible Plan G are also much lower. So it kind of depends on how you want to spend your money. If you want to pay more for your premium and then have a very low deductible, or if you want to rather pay a low premium and have a high deductible. But again, you probably want something that's going to be good for you long term. And so that's why a Plan G high deductible is not very popular today, and it's not even offered in every state. Most states it is, but a Plan G, normal Plan G, is typically more popular. Alright, the other very popular plan, other than a Plan G, is what is called a Plan N. Plan N is honestly very similar to a Plan G. You still have to pay your Part B deductible. Okay, so for 2025 it's $257. But then the difference is After that deductible, a Plan G covers everything 100%, okay, as long as Medicare approves it. A Plan N have smaller co-pays, okay, after that. So for any office visit, it is a $20 copay, okay, and for any emergency room visit, it is a $50 copay, okay, unless you end up being admitted into the hospital. Okay, if you end up being admitted into the hospital, you don't have to pay that $50 copay anymore. Okay, so Plan N also does not cover what's called an excess charge. Now, these charges are very rare. Okay, in fact, they're even illegal in some states. So I wouldn't really consider or have this be a big part of your consideration when you're choosing your plan. But you might want to factor in a little bit. Okay, so they're actually the excess charges are illegal in Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. Okay, and in fact, 99% of claims nationwide, not just in those states, but nationwide, 99% of claims do not have excess charges included. Okay, so it is a very rare thing, so I wouldn't let it be a big factor. Okay, but Plan N is typically cheaper than a Plan G. Okay, but you do have those small copays, $20 to see a doctor and $50 for an emergency room visit. All right, and then while it is not one of the most popular plans, okay, like a Plan G or Plan N, I did want to at least quickly mention a Plan F. Okay, so many people do have what's called a Plan F, but this is only available for individuals who turn 65 before 2020. Okay, so Plan F is technically the most comprehensible plan. Okay, I said Plan G is for most people. Plan F is technically the most comprehensible plan because it has no copay, it has no deductible. It even covers the Part B deductible of $257. Okay, so other than your monthly premium, you're covered. Okay, 100% covered. As long as Medicare approves it. Now, it typically is a bit more expensive than a Plan G. Right? And sometimes the difference between the premium of a Plan G and a Plan F, it makes more sense to have a Plan G with your Part B deductible of $257 rather than having a Plan F because you're going to spend more in your premium per year. But that may not always be the case. Okay, so again, it really kind of depends, which we're going to talk about now. Okay, so let's talk about the costs of Medicare supplement plans. Okay, first, it obviously depends on the plan that you choose. Okay, each plan differs on their monthly premiums and it's based on the coverage. So the more coverage you have, the more expensive the plan is going to be. Second, monthly premiums vary state by state, sometimes even by county or zip code by zip code. So it really depends on where you live. Your age and gender are also often factors in the premium amount. And many companies also offer a discount if you live with someone else over the age of 65. Okay, so for example, where I am in Virginia, a Plan G, okay, for a 65-year-old female would be $95 a month, and a Plan N, okay, would be $74 a month. Okay, and that doesn't include a discount. If you had another person in your home that's over 65, you would get a 10% discount off of that as well. Okay, so but it really does depend on a lot of different factors, your age, your gender, where you live. There are some states, however, that have what is called a community rate. Okay, so this means that the premium is the same no matter how old you are or whether you're male or female. Okay, it's the same rate for everybody. Premiums, however, can vary and always do vary from one company to another insurance company. Okay, however, what's important to note is the coverage is exactly the same. So whether you have a Plan N with insurance company A or insurance company B, it's going to be the exact same coverage. But insurance company A might be charging $15 more than insurance company B does. Okay, you probably are going to want to go with insurance company B. Okay, unless they have a history of raising their rates often, or maybe bad customer service or something along those lines, your coverage is exactly the same. So you probably want to get the best premium available. Okay, so this is why it's important to talk to an independent agent who works for many different companies or represents many different companies so you can get the best plan and the best price for you, which is exactly who we are. So if you are looking for the best rate, feel free to reach out and I'd be happy to get it for you. Okay, it is also important to note that Medicare supplement plans are medically underwritten plans. Okay, however, they are not during what is called your initial open enrollment period. Okay, so your initial open enrollment period starts the month that you turn 65, okay, or the month that you are new to Medicare, okay, if you've been on insurance through an employer or something like that, and it lasts for 6 months after that. Okay, however, you can apply for a Medicare supplement plan 6 months before you turn 65. Okay, so your initial open enrollment period is from the month you turn 65, and you have 6 months after that, okay, to get a Medicare supplement plan without any underwriting. But you are allowed also to apply 6 months before you turn 65. Okay, and we typically encourage people to do this because it will lock you in at a lower rate. Okay, if you apply 6 months before you turn 65 and then this insurance company raises their rates 3 months later, you are locked in at the rate that it was when you applied, not when you turned 65. So that's why we encourage people to get in as early as you possibly can. Now, there are some states that offer plans with little to no underwriting. Okay, so after your initial open enrollment period, if you want a Medicare supplement plan or if you want to switch Medicare supplement plans, you typically will have to go through an underwriting process. Okay, again, there's some states though that have plans that don't have any underwriting, but the rates on those plans, okay, the premiums, are usually much higher. Now, there are a few states that do allow you to change plans every year with no underwriting, but the majority of them do not. Okay, and typically the states that do, their premiums are usually higher as well. So it's important to get a plan that works for you now, but also will work for you in the future, because it may not be possible to change later on. Now, there are a lot of people who do change. Okay, they may change from a plan N to a plan G, or they may change from a plan N with one company to a plan N with another company because they may have a lower rate, and that is perfectly fine. Okay, if you're able to pass the underwriting, if you're still in relatively good health, then I encourage you to do that. In fact, if you want me to check to see if I can get you a better rate on your plan, okay, if you have a plan N, I might be able to find you a better rate, and if you're in good health, there's a good chance we'll be able to get you that lower rate. Okay, but if something were to happen and you're not able to pass the underwriting, then you're stuck with the plan that you had at that point. Okay, so it's important to get into a plan that you want long term. All right, so who should or should not get a Medicare supplement plan? Well, if you like to choose your own doctors, okay, then you definitely want a Medicare supplement plan because there are no networks. You can choose your own doctors. You are not limited to a network of doctors that usually are localized or regional that you have to go to. If you expect to have high medical expenses in the future, then you probably want a Medicare supplement plan. Or if you have a family history of chronic disease, you probably want a Medicare supplement plan because you can get a plan during your initial open enrollment period, okay, with no underwriting, and you'll be locked in. They can't drop you. A Medicare supplement plan cannot drop your coverage if you were to be diagnosed or have some chronic disease in the future. You are locked in with them. Okay, they also cannot raise your rates based on that. Okay, they can raise your rates sometimes based on your age, or sometimes they may raise their rates for everybody, but they can't raise it due to a diagnosis. Okay, if you travel a lot, a Medicare supplement plan is also a great plan for you because, again, it's covered everywhere, nationwide. Okay, it doesn't matter who you see, what hospital, as long as they accept Medicare, you're covered. If you like to know exactly what you'll be paying for your medical expenses, then a Medicare supplement plan is also a great idea for you. Okay, so for example, for a Plan G, you know that you're going to have to pay your monthly premium, and you also will have your Part B deductible of $257. But after that, 100% covered, right? You're not going to have any unexpected charges, like monstrous charges, a couple $1,000s here, a couple $1,000s there, because you know that you've already paid your $257 deductible, and you're good. Okay, so there's no surprise expenses with a Medicare supplement plan. All right, who should not get a Medicare supplement plan? Okay, if you have a retirement plan through an employer, okay, or through the state government or even the federal government, a lot of the times these plans work hand in hand with Medicare already. And so a Medicare supplement plan may not make sense to have in addition to what you already have. If you have TRICARE for life, okay, then a Medicare supplement plan would not be needed in addition to the coverage that you are already receiving. If you qualify for Medicaid, most likely a Medicare supplement plan will not be needed as well, in addition to the coverage that you'd already be receiving through Medicaid. Okay, so again, Medicare supplement plans are great for most people, but not necessarily everyone. Alright, and that brings me to the end of this video. So hopefully this helps answer some questions that you may have had about Medicare supplement plans. But if it didn't, if you have further questions, please reach out. Okay, the number and email on the screen is my personal contact information, so you will reach me. You're not going to get a recording or a call center, and I'd be happy to answer any other questions that you may have or help you find the perfect plan for you. Alright, thanks so much.